This station is designed to test an EMT candidate's ability to properly immobilize an injury to the shoulder joint. A second EMT will assist with this station. This station should take approximately 5 minutes to complete.
The key to managing a patient with an injury to the shoulder joint is to splint the affected area without causing further injury. Avoid any downward pressure on the injured extremity. Be sure to assess movement, sensation, and circulation before and after providing care.
Candidates at this station will have the equipment necessary to successfully immobilize a simulated shoulder joint injury. This includes a soft splint such as a pillow, triangular bandages, and medical exam gloves as part of the necessary personal protective equipment. There are 3 main sections of this station: assessing the injured area, immobilizing the injured area, and reassessing the injured area.
This is your joint injury station. You've had an opportunity to look over your equipment. Do you have any questions before we get started?
No.
Your patient has an injury to the right shoulder. I want you to go ahead and show me how you'd manage this injury.
Begin the station by indicating that the proper personal protective equipment is being used.
Okay, first of all, we use the appropriate body substance isolation procedures.
Okay.
Direct the application of manual stabilization of the injured area and then assess for motor, sensory, and distal circulatory function.
Okay, Pat, I want you to stabilize the extremity.
Sure.
Can you wiggle your fingers for me? Can you feel this?
The patient's motor, sensory, and circulatory functions are present and adequate.
Use a soft splint, sling, and binders to immobilize the bones above and below the injured joint. Reassess motor, sensory, and distal circulatory function.
Can you wiggle your fingers for me?
Yes.
Can you feel this?
Yes.
I have a pulse.
The patient's motor, sensory, and circulatory functions are present and adequate.
The examiner checks the candidate's performance against the critical criteria for the station. Items at this station that would result in failure include failing to support the joint to avoid bearing distal weight, failing to immobilize the bones above and below the injured joint, and failing to assess and reassess motor, sensory, and distal circulatory function before and after splinting.
When splinting a joint, remember, don't cause any additional injury. Be careful not to manipulate the injured area.